This video for educational purpose, not for treatment. Insulin therapy. When we give the insulin therapy, indications: type 1 diabetes, patient have autoimmune. In type 1 diabetes, patient have autoimmune disease in which the patient body produce antibodies against the beta cells of pancreas and destroy the beta cells, which cause decrease the production of insulin. It is most common in less than 30 age group. Second is, if the patient is type 2 diabetic and HbA1c is greater than 10%, then we start insulin therapy. Third indication is if the patient is type 2 diabetes and tolerated 3 stages of medication. First is metformin, and second glipizide and liraglutide like drugs, and third is anti-diabetic medication. In anti-diabetic medication, GPL1 analog and DPP inhibitors. It act on GPL1 hormones, which decrease the glucagon production and increase the insulin production. GPL1 analog act like GPL1 hormone, and DPP4 inhibitor is stop the or decrease the degradation of GPL1 hormone. And after the 3 stages of medication, if the patient is still higher than 7% of HbA1c, then start insulin therapy. Type of insulin: rapid acting insulin, which start acting within the 15 minutes and last up to 5 hours. What comes in rapid acting? Lispro, aspart, glulisine. Second is short acting. It start acting within 1 hour and effect up to 8 hours. What comes in? Human regular insulin. Intermediate acting. Start acting in 2 hours and effect up to 18 hours. What comes in? NPH. Last is long acting, which start in less than 2 hours and effect up to 24 hours. Detimir and glargine. Treatment process: start with long acting insulin like detimir and glargine 10 units before bedtime. The dose are adjusted depending on the fasting blood glucose of the next morning. What is the goal of insulin therapy treatment? Is 80 to 130 mg per dl fasting blood glucose. If patient have greater than 130 mg per dl fasting blood glucose, then gradually increase the dose of 1 to 2 units by 1 to 2 week. If the patient is fasting blood glucose is less than 80 mg per dl, then gradually decrease the dose of insulin therapy. After the 3 month of long acting insulin therapy, if the patient have still HbA1c is greater than 7%, add a rapid acting insulin before the biggest meal of the day. 1 to 2 doses of rapid acting insulin can be added throughout the day. And building up to an insulin therapy scheme called basal bolus scheme. What is in basal bolus scheme? In basal bolus scheme, it mimics the way that pancreas naturally release insulin. 3 short acting insulin before breakfast, lunch and dinner, and 1 long acting insulin before the bedtime, which seen in this picture. 3 short acting 1, 2 and 3, and one is long acting insulin doses. The risk of hypoglycemia, so measure the blood glucose before each sort of insulin. Measure the blood glucose each sort of insulin. In diabetic emergencies, we also give insulin therapy like diabetic ketoacidosis and diabetic hyperosmolar hyperglycemic state, in which the blood glucose is much more higher than the normal blood glucose. So we start insulin therapy.